Good afternoon. I'm here today at the World Implant Expo with Dr. Salman Ali. Good afternoon,
Good
doctor.
afternoon.
My name is Dr. Tia Paul. Sir is a well-known implantologist and he's practicing in Riyadh, Saudi Arabia. Sir, it's very pleased to have you here.
Pleasure's all mine. Pleasure's all mine. Thank you for inviting. I think this is supposed to be the best implant expo, and the good part is it's all about education. I see very less companies promoting themselves, so it's an unbiased expo, which is really good, which focuses only on education, and I'm happy to be here.
Thank you, sir. So would you like to tell us a little bit more about yourself?
Okay, my name is Dr. Salman Ali. Actually, I did PG diploma in implants from UK, and I graduated from India, and I'm also into research, like it's a part-time hobby, and clinician, as well as I educate for implants. Like I'm a training and education head, one of the implant companies. And I love this, like I love exploring new opportunities, and my specific forte is towards digital and how digital will change everything in implants, how accurate, how predictable, and how easy it is to actually go towards the digital route for implants.
So were you always into dentistry, or is there something that got you into it?
Actually, I wanted to be a boxer, to be honest. So I boxed for around like 5 years, and then I left it because to be honest, it's all about money. I thought dentistry is one of the most, like dentistry will make you rich if you do it right. And you have to be really honest with whatever you do. So I was personally interested in surgery. I like surgery very much. And implant, it's always been a very interesting topic since I was in my bachelor's. So I pursued something which was very specific for implants. So it's in general, like for young dentists, my advice is just see what you want to do and enhance your surgical or your technical or your digital skills accordingly. So for example, if you're into endo, explore new file systems. If you're into implants, try as many systems as you can. Learn more about the systems, because don't follow someone. It is always good to have a mentor, but you should always try to gain as much knowledge as you can on your own. So that's my 2 bit. So about digital, I think just like AI works, in implants, a clinician should work like an AI. The more data he has, the more predictable treatment he can do. So I think the workflow for implants is the most basic is acquire CBCT data, acquire facial scans, acquire the tissue profile or the impressions. Try to do as much digital planning as you can, and deliver a digital prosthesis. It will minimize your error. So I think that's something which encloses all the topics. And if you have any questions, please.
So would you like to give some tips for people who are getting into implantology?
Yeah, I'd like to give 5 tips. Oh, 4 tips actually, not 5. 4 tips. So the first tip is understand the bone. That's what the part of data acquisition is. Understand the bone, like what type of bone you are dealing with, how much you have. So this is both qualitative and quantitative data acquisition of the bone part. The other most important part, and often neglected by most of the dentists or implant surgeons, is the tissue. Implant has a biologic width. If that's one of the reasons that you have peri-implantitis. So the biologic width in implants is around 3.5 to 4. And that is what decides the placement of implant, where you're supposed to place it. Maybe equicrestal, maybe subcrestal, and subcrestal by how many millis. So this is really important that you guys should focus on. Third thing is the prosthesis. What type, what design? I would like to suggest you to go digital because it's more precise, it's accurate. Some of the milling machines have an accuracy for 5 microns, which is amazing. Taking a scan, it's easy. I personally don't like taking impressions manual, so digital scan is the way. You have to invest for sure. And the last one is the patient compliance. Don't treat the patients like you should say no to patients sometimes. I know it's a very difficult job to say no or deny a patient from the treatment, but you don't want to see you always want to see the back of the patient. You don't want to see the face of the patient again and again. So this is what you can easily do. And for me, I think predictability is the most important thing in implants. There are some things you can't control, like bone healing potential of the patient, attitude of the patients. So, but you can actually control majority of the things. You can modify your osteotomies. You can modify the bone. You can modify the tissues by surgical procedures. You can design a beautiful prosthesis. You have like different variety of materials to choose from. So provisionalize if you're not sure. Progressive load is another option, like slow progressive loading will give you more time for the patient, and it will be good for you to heal for long term. Like it will buy you some more time for the implant healing, and that's it. So I think that's more than enough.
So how do you stay up to date with all these latest technologies?
Courses. I think after a couple of years, everything will be quite digitized. So people will place an implant, take a scan, send it to the lab will 3D print, mill, choice of materials there, PMMA, zircon. So you have plenty of options to choose from. And also like materials get invented every day. New materials and new implant systems are there. So try everything, don't shy away. Don't stop yourself or don't limit yourself with specific systems. See everything which is there in the market. Learn from those things, how they work, how good they are, because it can be a new system which can break the barriers of all the old systems which are there in the market. Something new, something digital. So I think that would be an amazing thing.
Thank you so much, sir.
Thank you so much.
Thank you so much.